A conversation urgent and deeply important. We're breaking down what's changing in healthcare policy. Joining the Global Black Economic Forum stage for a Declaration of Independence discussion, please welcome Shanley Chien, Senior Health Editor at U.S. News and World Report, Dr. Imamu Tomlinson, MD, Chief Executive Officer at Vituity, Dr. Marquita Willis, MD, American Psychiatric Association, and Dr. Melissa Whitt-Glover, Chief Executive Officer of the Council on Black Health.
Ready? Good afternoon, everyone, and welcome to our conversation, Healthcare Under Attack, What You Need to Know. My name is Shanley Chien. I'm a Senior Editor of Health at U.S. News and World Report. And at U.S. News, our mission is to help our audiences of consumers and industry leaders alike make better choices and make better informed decisions, particularly around healthcare for the people that it impacts. So I am very excited to be here with you all today to discuss this critical issue of health equity and access. In 2026, healthcare costs are climbing as federal subsidies end and Medicaid rollbacks take effect. In fact, newly released data shows that about 3 million fewer people were enrolled in health insurance coverage under the Affordable Care Act. And in fact, many of these changes disproportionately affect Black and other underserved communities the hardest due to systemic economic disparities, forcing many to choose between life-saving medical costs and life-sustaining essentials like rent, utilities, groceries, and health and childcare. As an Asian American, I recognize that these policy changes do not affect every population equally, which is why I want to be very clear about my role here today. I'm not here to speak on the community's on the lived experiences. I'm here as an ally to help facilitate this incredibly important conversation and to ensure that we amplify the voices of Black medical and public health leaders. So, without further ado, I'd like to introduce our very distinguished panel. We have Dr. Mood Tomlinson, CEO of Vituity and President of the Vituity Cares Foundation, who directs major initiatives in emergency care delivery and health equity. Dr. Marquita Willis, CEO and Medical Director of the American Psychiatric Association, who leads national efforts to expand mental health care and access, as well as reducing barriers to care. And we have Dr. Melissa Whitt-Glover, CEO of the Council on Black Health, whose research and advocacy focus directly on the structural and public health changes that shape daily life in Black communities. Welcome, everybody. There's a famous saying that goes, when America catches a cold, the Black community catches the flu. And right now, as major health insurance subsidies expire and coverage costs skyrocket, data shows that Black households are being hit first and foremost. From your respective roles in emergency care, mental health, and public health, what does this current attack on healthcare look like on the ground for Black and other underserved patients, families, and communities?
Yeah, hey everybody, how you doing? Yeah, so I think the major part that I see in respect to what's happening now is that there's a lot of confusion. And I think when you have confusion when it's related to healthcare, that's a big problem. And people want to be empowered about how they care for their health, how they care for their families. And when you don't know where to go, what's the right place of care, what's the right place to get the screenings that I need, or what's the right place to be cared for in an emergency, that creates a chaos that is not good for our communities and not good for healthcare in general. So I think, I'll start and explain more of what I think we can do to fix that. But I think right now it just seems like a really chaotic time.
I'll echo that. I agree, and I think the confusion, a lot of the reason that people are losing coverage is because of paperwork, and so when people are confused about how to make sure that they have access to care, that also creates chaos. And there are lots of people that are eligible, but they lose access because they don't understand the system. And so I agree with you, and I think we're going to talk a little bit more about how we can make sure that people understand how to access care, how to make sure they know what their benefits are, and then how to make sure that they're taking advantage of those.
Yeah, and with HR 1, which was also known as the Big Beautiful Bill, Medicaid got cut. And as we know, many of the mental health benefits are paid for by Medicaid. It's the largest payer of benefits for mental health and substance abuse treatment. And so that's a big concern for us, and certainly a concern for communities of color. As you said, America gets the cold, the communities of color get the flu. We are very concerned and bracing for a crisis within a crisis on mental health because of some of these cuts.
Absolutely, and as we're talking about a lot of those cuts and really the financial reality of how losing coverage can affect families. So if someone in this room gets hit, or their loved one gets hit with an unexpected premium hike or coverage cancellation this year, what are the exact actionable steps that they can take to navigate the system without going into medical debt?
I would say the number one theme for me in this problem and others is patient agency. And I'll describe what I mean by that. All of you out there have the ability to take ownership of your care. So I get it, right? Premiums, what paperwork do you have to fill out? But the first step is to ask questions. The first step is to be disagreeable and challenge not just your physician or your primary care provider, but you need to challenge your insurer. You need to say, that's not covered, why? What else can I do to get the care and the coverage that I need? So the other thing I'd say is look for alternative ways to engage in the healthcare system. We have so many opportunities now with telemodels and other models to get engaged in the healthcare system that is not just with the traditional models that we've had in the past. So be disruptive, go try to do, pursue your healthcare in other ways, and also ask questions, be disagreeable.
And there are places within our healthcare system where folks can find care, even if they don't have insurance. So there are clinics. There are clinics such as federally qualified health centers who take folks regardless of insurance status. So if you or a church member, a loved one, find yourselves in that situation, remember there are places where you can still go get your preventive care.
And what I would say is, in addition to what you all are saying, is for those of us that understand how to navigate these systems, we need to help other people in our communities. And so if there's a federally qualified health center or another clinic or ways to access paperwork, one of the things that we do in the Council on Black Health is we train people who help others navigate, what we call trusted navigators, people in communities who understand how to navigate systems. Because if I'm a part of the community, if I know how to navigate something, then everybody around me should also know how to navigate that. And by us working together, that's how we can make sure that people stay covered.
It's already an extremely confusing landscape already, the healthcare system. So being able to navigate it is actually a very critical part of advocating for your own health and making sure that you're getting the right healthcare in the first place. But even before then, I know a lot of health and medicine experts really emphasize the importance of prevention, whether it's getting your annual checkup or going for screenings before medical issues worsen. But taking preventative measures can inherently be challenging when there are already systemic barriers, including access to care and healthy food, that make going to see a doctor and even just living a healthy lifestyle very challenging already. So Dr. Whitt-Glover, the Council on Black Health focuses very deeply on the structural issues like food access and community disinvestment that impact the well-being of Black neighborhoods. With these new federal laws cutting back on healthcare access and disproportionately affecting Black communities, what preventative measures can families take to prioritize their wellness before these issues come up? What are your 3 pro tips?
So I think that the three main ones are the ones that we always hear about. So healthy eating, moving your body, and then controlling stress. One of the things that we've been focusing on at the Council on Black Health is understanding, our goal is to achieve optimal health in Black communities. And when we ask people what that looks like, it is joy, it is contentment, it is those kinds of things. And when we ask people what's preventing us from being there, the number one thing is us being connected to each other. So when you think about financial wellness, when you think about emotional wellness, when you think about physical wellness, it is us being connected to each other as communities that can help us to be healthier. So when you think about stress reduction, us being connected to people who are like-minded, being in community, that's going to reduce stress, so that's going to improve health. When you think about things like exercising, physical activity, us being outside and being connected with people in our communities and our neighborhoods, that's when we're moving our bodies. It's not just, going to the gym and punishing ourselves. It's that natural joy, being connected to each other. And the same thing with food. I think eating healthy foods, eating whole foods, buying from our communities, buying from, I shop a lot at farmers markets now, but those kinds of things will help us to be able to achieve the care, the health before we have to go to the doctor's office.
And building on what the good doctor said, there's actually a relatively new field of medicine called lifestyle medicine. And the three pillars that the doctor mentioned, healthy eating, stress management, are absolutely important. There are a couple more as well. Sleep. Getting 6 to 8 hours of sleep every night is critical. People don't prioritize sleep enough, but our brains need to rest in order to be optimized and in order for us to be our best selves for what we have to face for the next day. So sleep is absolutely important. Cutting down on risky substances. If folks smoke, quit. I mean, that's just one of the most important preventative things. If folks smoke cigarettes or inhaling anything, whether it's vaping, which hasn't been studied, whether it's marijuana, the smoke in and of itself is not healthy for us, and we need to quit that. And then last but not least is, believe it or not, it ties in with stress management, healthy connections. And so the healthy connections that we have with our family, and notice I said healthy. There are some connections that we have with other people that drain us. And it's a chronic drain because we aren't getting along with somebody. Learning to love folks from a distance is important. And all of those things, all of those 6 things, the 3 that she discussed, the 3 that I discussed, are the pillars of lifestyle medicine. And I personally like to add a 7th. And my 7th is how we interact with our world, how we interact with the globe, putting our feet in dirt. I know it sounds silly, but hugging a tree, getting outside, being a part of nature, that's also part of wellness. We're part of a global ecosystem. We interact with the planet around us, and so being intentional about that is important as well.
Yeah, I agree with all of those. And I'm listening to you and I'm thinking about how many things that I'm guilty of. And 3 physicians up here, in some ways can sound like we're telling y'all, sort of what to do. So I want to give y'all a little grace in this, and all of these things that you're supposed to do. It's okay to falter. Clearly, I am faltering. And so it's okay to falter a little bit, but ultimately you want to get to point Z. But it's okay to struggle a little bit. We struggle with it, different aspects of it, and you are going to struggle with it. So it doesn't have to be that you snap your fingers and all of a sudden you're 100% healthy. It's going to be fits and starts, and that's okay. And we're here to support you along the way.
So I'm going to ask all 3 of you a question that I didn't include in our preparation questions. Personally, what is the number one thing that you have done or adopted to prevent and ensure that you live a healthy lifestyle? What is your number one lifestyle habit that you personally adopted?
My number one, I can say this unequivocally, it has transformed my life. And that has been yoga and meditation. That has just actually transformed my life in every aspect. It allows me to be, as Dr. Tomlinson said, more stick to these things that we're saying more. You can tell that I don't miss meals either. But portion control has been important, and that mindful eating, mindful interactions has just been a lifesaver for me in terms of balancing work and home responsibilities. So for me, it's yoga and meditation.
I wish we had more time and were wearing appropriate clothes to have you lead us through a yoga session.
I'm going to give you two. One is I started drinking water. I used to go all day and never drink anything. Look at you opening the water. But I started drinking water. The second thing is I'm really highlighting the social connection and being connected with people. I want to give a shout out to a group in North Carolina called Let's Get Social Raleigh, which has done phenomenal work to connect adults with other adults so that we are not isolated and being alone. And that by itself lowers stress, lowers cortisol, gives you a healthier outlook, and that has gotten me out of my house. So drinking water, but not minding my business. Drinking water and then being out with other people.
Those are two really good ones.
I was hoping that you would skip to the next question. I struggle with sleep. I don't, sleep is a struggle for me, to be honest. But what I try to do is I try to do something active every day. I try to be active, and I think where I fall in the trap is I want it structured. Like, oh, let's go and run 3 miles, or let's go and lift these weights. But what I've found is that when I'm active, when I do things even for a short period of time, I feel better, and ultimately it's easier to manage my weight and blood pressure and all those things.
And all of these things add up to living a healthier lifestyle and making sure that you don't have chronic health issues later on down the line. It's a lot of preventative steps, but it's so good for your mental health as well. So talking about mental health, obviously that's our next topic here. When people lose coverage or face uncertainty, or even just, as you were saying, navigating the healthcare system, which is very confusing, there's a lot of stress and anxiety that goes with that entire process. So Dr. Wills, as the CEO of the American Psychiatric Association, you've spoken out about how many in the Black community carry very unique layers of stress and trauma, yet mental health care is often the first thing that's sacrificed when affordable and equitable access becomes even more challenging and limited. So what can people in this room do to protect their mental health right now? And how can they find culturally competent care that truly understands them and allows them to feel seen and heard?
Great question, and thank you for the opportunity to chat with folks about that. Mental health is truly our gift to ourselves to unlock wellness in all other aspects of our life, whether that be our vocation, our finances, our spirituality, our physical health. We need our mental health to be optimized in order to be our best selves. And in order to do that, to me, one of the most important things that people can do, if they don't want to go get formal treatment, truly, is exercising. Exercising is the number one thing, and I'm not talking, you don't have to run a marathon. It can be a 30-minute brisk walk, 30 minutes of putting on music in your house and dancing, 30 minutes of going to a pool and walking. I know I do that a lot. I go to my community pool center. I don't want to get my hair wet, but I walk in the water, and that helps me stay active and fit. Because when we do exercise, our brain releases endorphins, and those endorphins are happy juices that keep our mental health going. So people underestimate how inextricably tied our physical health is to our mental health, but exercise for me is the number one thing that we can do to improve our mental health. Now look, we all get stressed, we all get sad, but how do we know when things move from being anxious because I'm walking on a stage talking to these illustrious folks that I'm with today, versus having an anxiety disorder, or being sad versus being clinically depressed? And the first couple places that I think people should go if someone is having challenges, if you're noticing that loved ones are having challenges, number one, your primary care physician. That's probably the best
portal of entry, if you will, into accessing mental health care should you need more than sort of everyday community supports that we all enjoy. And number two, church. Church is a great place to go to your pastor or your deacons and deaconesses to talk about what's going on with you. And they oftentimes can navigate you to therapists or higher levels of care if they're required. So that would be the way that I would begin to access care for mental health services if I needed it.
You know, I think that really brings up an interesting topic because I feel as though I would be very remiss if I didn't bring up AI and health. So I'm going to turn to everybody in this audience right now and see how many of y'all actually have used ChatGPT or some other AI to ask questions about their health. I know I have. I literally did it this morning. So let's talk about the role of AI in healthcare, whether it's mental health, emergency care, or public health, because it is starting to help bridge certain gaps, huge gaps in healthcare, especially getting good healthcare information and navigating the healthcare system, but it's still a very much emerging technology. So there's a double-edged sword. So from your respective backgrounds and experiences, I'd love to learn more about what role AI plays and how people should use it to navigate their care.
So I'm going to compete with the auction going on over here. You know, I think for me, AI is important for us to dive into. I would encourage everybody to dive into it, to participate in it, because you can't understand it if you don't participate in it. I know a lot of people say, hey, it's not fully loaded. Hey, it's not something that's good for black folks. I get that. But if you don't know what it is, you're even at a greater disadvantage. And I would say this, how many of you trust your doctor empirically? Some of you, right? Challenge your doctor and make sure that you hold them accountable, but we also have to hold the AI accountable. Don't just trust it empirically. Understand that it is another source of data, but hold it to the same level of accountability that you hold anybody you talk to about your healthcare. Ultimately, you are in charge. This is another tool, but the decisions that you are going to make are based on you looking at all that data, hopefully with someone like us facilitating that conversation and then making a prudent decision based on the outcomes you want.
How damaging is it to trust AI without asking or pushing back on it? What are some of the implications of just trusting it blindly?
Say that again.
What are some of the implications of trusting AI blindly without asking questions?
Yeah, I think trusting anybody, trusting me blindly is bad. You know, I mean, I think you don't want to trust anything blindly. You want to interrogate it. You want to make sure that it makes sense. You want to double check it. You know, go to your doctor and say, hey, ChatGPT told me to do X. Is that right? I think you want to make sure that you always don't just take it for face value and really put some scrutiny behind the information you're getting.
At the APA, instead of calling AI artificial intelligence, we use the term augmented intelligence. I get the question asked of me all the time, Doc, do you think that AI is ultimately going to replace therapists, social workers, psychiatrists, those who deliver mental health care? Because people right now are already using ChatGPT for psychotherapy, so-called psychotherapy. And my answer to that is, I don't think that AI is going to replace clinicians, but I do think that clinicians who use AI are going to replace clinicians who don't. And so it's important that clinicians get comfortable with AI so that they can understand it and share with their clients, with their patients, the good ways to use it. As the good doctor said, how to test it, when to interrogate it again, repeatedly, how to interrogate it again. So I know at the APA, we're actually developing tools to help people understand how to use AI. I will say this unequivocally. Right now, this is still an emerging technology. It is not ready for solo use on prime time. I'll say it again. AI is not ready for prime time on solo use without some type of clinician oversight. And I think all of us in our respective roles are using this time right now to really help define, from a medical perspective, when to use AI, what those guardrails are, what those barriers should be. But it's something that we're all going to have to contend with. And I agree with Mu here. Dr. Mu, we got to get in there and use it so that we can influence it and make sure that the models that sit behind it are not biased against those people who look like us.
And I think it's, if you think about having a toolbox, you don't just have one tool in your toolbox. You have a hammer, you have a screwdriver, you have, that's the extent of my tool knowledge, so I'm going to stop. But you can use AI like a tool. And so if you think about it from the perspective of healthcare, no, it shouldn't replace your physician, but it can do things like it can help you to understand which questions you should ask when you go in so that you have your list of questions so you get everything answered. If you get information from your provider, you can use ChatGPT or AI. You can use that to help break down and maybe explain things in ways that help you to understand it if you don't necessarily understand things. And that can help, I think it can help to strengthen the conversations with your providers.
Yeah. Just a shameless plug. If you guys want to experience what an AI sort of pre-physician can look like, you go to that back corner, we have an AI pre-physician tool that can help you ask your questions to your doctor. It's not a doctor, but it'll give you the framework to do that. So you can experiment here and see what that looks like if you're sort of nervous about trying it.
So on that note, I feel like, people here are a lot more inclined to trust AI than their doctors, especially when there's a lot of medical mistrust historically and systemically. So since you were just talking about that, Dr. Tomlinson, when a patient walks into an ER or a clinic in today's very high-stress environment, how can people advocate for themselves, for their health, to really ensure that their voices are heard and to make sure that they can trust their doctors and vice versa?
Yeah, so I talk about, there's two words here, advocacy, which I think you're an advocate when you try to empower yourself or those you're in charge of their care. You say, I want the best for me. I like the word agency. Agency means that I am advocating for myself, but I'm using data and information and tools to double check the people that are trying to help me. So I would say when you go to the ER, and as challenging as it may be sometimes to work in that environment, come with your ChatGPT explanation. Come with the tools. Bring the medical books with you and said, I was reading about this, sir, and I think I have this. And now that conversation is at a higher level than when you just walk in the room and say, doctor, please tell me what's wrong with me. So I would encourage agency, go out there, get the information. There was a time where, as a physician, I would give you all knowledge about yourself and about the care you're receiving. Now I'm your partner. Now I'm your facilitator. I'm helping you navigate. It's not just knowledge-based. So I would say, go out there, bring every piece of data you can to the doctor and say, hey, with this information, what more can you tell me about the condition I'm dealing with?
So it really sounds like once you bring ChatGPT into that conversation with your doctor, you can really challenge them in real time and have that conversation.
Absolutely, and that's okay. I think all of us, we're excited about that conversation. It's no longer just about, okay, I'm going to tell you what to do and maybe you do it. Now you're engaged and empowered, and we see that the patients that are engaged and empowered, they follow through.
Dr. Whitglover, I feel like there was something that you wanted to add to that as well.
No.
So let's talk about health as an act of resistance, especially in the Black culture. And the legendary writer Audre Lorde had famously written, caring for myself is not self-indulgence, it is self-preservation, and that is an act of political warfare. So for a community that has historically been neglected and ignored and exploited by institutions, choosing to prioritize your own health is almost an extraordinarily revolutionary act in and of itself. So with the healthcare system being harder to navigate because of how complex and confusing it is, how do you hope people in this room can prioritize their self-care, whether it's through preventative measures or through their community? As we approach this, what should they do to ensure that they are self-caring for themselves?
putting your health first really is an act of saying, I matter. I have value. I take up space on this earth, and I need to be my best self because while I'm on this earth, I am going to contribute. And pouring into yourself in that way, with exercise, with good sleep, by avoiding risky substances, by going and getting your checkups, in some ways is also a form of worship for those who believe. It is saying, I'm going to take care of the temple that was gifted to me while I'm doing this journey on earth. And so that, just the belief that you are the most important person, that you have to protect yourself, that is a deep form of resistance. Again, in the face of people that say oftentimes that people who look like us don't matter. But taking that to its final degree, pouring into yourself so that then you can pour into others with your gifts and talents from your overflow is critically important. And so I love that question. How is health tied to resistance? How is health tied to ensuring that we as a people are empowered? It starts with ourselves, and then we operate from our overflow into our families, into our churches, into our communities. So that's how I'd answer that question.
I love that.
And I would say we have to believe that we deserve it. We have been surviving for a long time. We know how to survive. We have to believe that we deserve to thrive. And that's what I think that looks like. That resistance is us thriving and not just getting by, but living our full lives and being the happiest and healthiest we can be. And once we believe we deserve it, then it becomes less of resistance and more of this is what we're doing because this is what we deserve.
Yeah, lastly, I would say just make goals. Make it real. Just make goals. You don't, again, you're going to start, you're going to stop. Make goals, monthly, weekly, yearly goals, and hold yourself to account.
So as we wrap up, because I know we're about at that time, what is your call to action for everybody in this room to really harness and mobilize their collective power to advocate for themselves, to empower themselves, and to have that agency to affect change for themselves, their own health, as well as for the people in their community?
I would say just, again, I'll repeat, be repetitive. Take control of that interaction. Whenever you interact with health in any way, shape, or form, it could be the doctor's office, it could be the yoga that you're going to get. I think you just have to make sure that you take ownership of it and control of it. Don't let anybody tell you what to do. Work with them to figure out what to do together.
And I'm a little biased, of course, being a mental health professional, but I believe that protecting one's health really starts with protecting one's peace. Protecting your peace against all the drama, ups and downs that come with life, making sure that you maintain an appropriate distance and perspective from that so that you can then do everything you need to do to take care of yourselves and your loved ones who are immediately around you. Whether that means finding a few quiet moments to listen to your favorite song, whether that means going walking with a friend. For me, it's finding that quiet solitude on the yoga mat. Whatever that is for you, protect your peace and be vigilant about it.
And I would, similarly, I would say stay connected, make authentic connections with people, because together we can survive and we can be healthier, we can thrive. But I've heard somebody say it's going to take all of us to save us. We have to be connected with each other and be in community with each other so that we can all rise together.
Well, Dr. Whitglover, Dr. Wills, Dr. Tomlinson, thank you so much for sharing your insights. Before we wrap up, is there anything else you want to say, something that you want people to walk away?
No, I just said thank you for the opportunity to speak to everybody, and I think we have some good messages and values here that they can take forward.
No health without mental health.
Stay connected to each other.
Thank you so much. Thank you, everybody.